Hi, and welcome to 21st Century Healthcare Consultants official podcast. This is Home Care Today. My name is Kate Rose. I'm your host, and I look forward to spending the next few minutes with anybody who happened to drop in to catch this podcast. I'm extremely happy today to be able to introduce my first guest, Greg Bean, who is the Vice President of Business Development for Paradigm Seniors. Greg has been both personally and professionally affiliated with healthcare in a variety of different ways, and we'll maybe talk about some of that, but primarily I want to bring Greg in today to talk with us about how his company is working to help assist and provide for those agencies, home care health agencies, that are working closely with folks involved with veteran affairs, with Medicaid, and just other hosts of organizations that are dealing with healthcare in the concept or in the context of dealing with home care today. So Greg, thanks so much for being on our podcast. It's really a pleasure to meet you. We had a few minutes to chat before the show got started, and we were discussing how we both actually hail from I started to say professional, it almost feels professional if it's been a lifelong relationship with the military, both through our families.
Well, thank you very much. Thanks for having me on.
So again, thank you for your service. And we're happy to have you here. I'm just going to go ahead and jump right in, if that's okay with you, because you have so much that you can share with us today. And I know that a lot of our viewers are going to be interested in knowing how to maybe rethink the way that they help their clients navigate what can be at times a pretty difficult road, and that is dealing with providing services through the Veterans Administration. So let's just start there. What do you see as the most pressing challenges that veterans are facing today as they transition from the military sector into civilian life?
First and foremost, I would say, we step out of the military. We were briefly chatting about the language, the culture, the idea, who we are in the military. But when we step out of the military, we have to adjust to a whole different way of life. There's a structure associated with the military. There's a discipline associated with the military. The jobs in the military frequently don't transition over to a job when you leave the military. So what does that look like? Are you prepared for the life challenges that are going to step out, not just from a health standpoint, but an emotional standpoint and a physical standpoint and all the things that are going on? So I'm going from a culture of potentially discipline, direction, consistency to not having a clue what I'm going to do next in my life. And then we have a Veterans Administration who do not do a very good job of communicating with these young people. And typically they're young people. They come in, they're getting out there in their early 20s, and they don't have a clue what resources there are. Where do they go find them? What's available to them? And as a country, as a culture, we do not set them up for success many times. We have amazing websites that if they're really savvy, they can go in and navigate their way around and try to find things. But what are they genuinely eligible for? And where can they go find those answers? And typically, we don't see that done well. I would use a great example. I had a young man reach out to me who was a friend of my son who's active duty. And he said to me, of course, his first name was Mr. Bean, which made me feel good because it was respectful when he spoke to me on the phone. But he said, I'm getting ready to get out of the Air Force Special Forces. Do you know if there's any job placement agencies or someplace out there that can help direct me with my specialty and my needs to find a job as we move forward? And I was able to connect him with a couple of individuals that I had that were resources that were talking back through some placement agencies and some opportunities that we were able to Google and find some names and some people that I knew that I'd had conversations with that were in like some governmental pieces because of his specific skill set to maybe move into a law enforcement type of opportunity. But what happens to the young man who is working in a completely different environment, who doesn't have the ability to connect with a Greg, who might have a contact of someone he knew who are otherwise, where do they find those things? Every single county in the United States of America has a veteran service office. And that veteran service office actually has the ability to help understand what resources in their community are there for veterans.
Greg, and I know this, you might not have this on the top of your head, although maybe you will. What percentage of veterans are actually taking advantage of the benefits that are available to them in this country? Do you know?
At just overall numbers, how many veterans are there in the United States? We know there's somewhere in the ballpark of about 17 million, give or take a few hundred up or down, and I mean to be exact. When we look at the number of service connected or people who actually have a disability who have filed for and affiliated with, it's about 4 million. So 4.5 million. So that's a significant number of veterans versus those that have disabilities. Then we look at how many people are actually receiving care and services
Mm-hmm.
back through the VA's health network. And we know that 80% of our veteran population, according to what the VA has said. Now, I was in the VA speaking to them in Washington, D.C. last year, and they used the number of 80% never set foot in a VA facility. So if I'm looking at that from a number standpoint, that's a
Is
pretty
that right?
significant difference in how many are actually receiving care services and so on, that over 80% of our veteran population never sets foot in a VA facility. Lack of knowledge, benefits and opportunities available to them. In it used to be typically they would say if you have a service connected disability, the only reason you can go be seen at the VA was specific to what your disability was. So if you had injured your legs in the military, you could go be seen for your injured legs. Well, it's not that way today. In today's world, you can actually go be seen for any of your health benefits.
Hmm.
You don't have to have a service connected disability to enroll in VA health benefits. And if you were served active duty and you were and there's income requirements within it, but anybody that meets the financial income requirements can actually enroll as a veteran into VA health. And I don't think most veterans are aware, and it's a pretty significant number. I think the national average is about $57,600 a year. So if you're making less than 57,000 a year in most places, if you were in Colorado, that the threshold for that's 80,000. So you can make a significant amount of money, have been
Wow.
discharged from the military honorably, and enroll in VA health benefits as your health resource. And I don't think that's something that's just, you don't see any commercials on TV that are saying,
Yeah.
hey, did you know that if you served in the military and you only make this much money, that you could enroll in VA health benefits and receive all your services and care through the VA?
I know. You know, my father retired as a full colonel after serving 32 years in the Air Force. And he was a sharp guy. He did 2 tours in Vietnam. He did Korea before that. He did Cambodia. He was director of operations for an infamous POW rescue mission back in the day. And yet, my father, when he retired, did not file for any VA disability. And even as he continued to get older, we as his family, we could see how that impacted his health care. Yes, he still had benefits through Medicare and through TRICARE, which is the military standard for insurance for a lot of us. But even something as simple as his hearing aids, he didn't at the time go through the process to be evaluated and so that he could have the benefits that he was entitled to, because he didn't want to have to deal with the red tape. He felt like a complete just a very confusing process to someone who's very intelligent, who was indoctrinated into military benefits as such. And yet we had a heck of a time helping him to get hearing aids, and we ended up having to go civilian at that point because too many years had passed and it would have been too hard to get him back into the VA. But my point is, even the education process for the active duty members before they leave, I wonder sometimes if that might be a little bit thin as well.
I think the reality is many think they're not eligible, and no one's really pointing them down the path
Mm-hmm.
of how they can figure out what that eligibility is. The other thing is we've made enrollment into benefits so challenging and so difficult over the years. You have to get a copy of a form, and you have to get a copy of your DD 214, and you have to get your financials, and you have to get all these wonderful things. A veteran can actually do their entire enrollment into the VA's health benefits over the phone in a single phone call. They can pick up the phone. I'll even give you the phone number in our podcast. They can dial 877-222-8387. They'll get an enrollment specialist. It's 877
Can you repeat that, please?
222
Repeat that.
8387. They're going to ask them how much their income is. They're going to ask them, um, you know, date of birth, social security number, all that wonderful stuff. They can pull up their DD 214 and all that information with them on the phone. While they're on the phone, they can actually even then schedule them with the VA physician to be seen for their assessment and evaluation, to be seen for health benefits, all with one phone call. Now, that call takes about 30 minutes. I tell veterans plan on a 2-hour phone call. The first 50 minutes to an hour is going to be on hold. So be prepared for that. But at the end of the day, you can
Uh-huh,
literally be
uh-huh.
scheduled with service to be provided within the VA's health network. Instead of the red tape and trying to find documents, I mean, we get out of the military, we go, wait, do we know how to find a copy of our DD 214? And if you're a 70-year-old person who's moved 65 times in the past 50 years from when you got out, you have no clue where those documents are.
Right, right. That is so, so true. We went through that with my dad, as a matter of fact. Well, Greg, tell me this. How does you have such an affinity for this particular aspect of healthcare through the VA, but tell us a little bit more about what you do at Paradigm Seniors and why you do it.
Is genuinely a billing and revenue cycle management company that does all the billing for home care agencies. And we have over 3,000 agencies that we work for on the opposite side. But my role within business development and my education team within business development and so on, our responsibility, our job, and what we do every single day is we do webinars and training and education and conferences to teach home care providers how to provide both education, opportunity, enrollment, what their benefit eligibilities are, and actually help be all of our agencies across the world. I don't care where you are and when you are, to become an advocate and an educator to veterans, because their responsibility is to get out and let veterans know.
Mm,
When we look at the number of people receiving home care hourly services within the system in the United States, there's about 173,000 veterans in the entire United States that actually get service and care in home, like a home health aide to
mm,
provide them with care. But we have over 10 million veterans over the age of 65.
mhm.
So if we have that large of an aging population that need personal care in the home, that don't know about it, it's our responsibility to not just help with that, but we work with them to assist with the VSOs to help people with home modifications. And I've even had the VA come in and assist people with removal of items and so on for someone who might have been a hoarder, who couldn't get caregivers in and couldn't get services provided because they were just in a emotionally and physically debilitated state, that they weren't able to function in the system where they were. But the VA has resources and pieces and parts where they can go in and assist with those things. They even help with, there's a young man in central Pennsylvania, one of the veteran service offices. If you were to speak to him, his entire purpose in life is to eliminate veteran homelessness. So he works with a group of investors that go around the state building mini homes for homeless veterans. And I know that they've built over 250 of them. So there's
Nice.
these resources that are going on in the VA and your veteran service officers and people that are helping people in need that just need to go figure out and find out where to find them. So what we do and what we educate people in all over the country in our trainings and our statewide, nationwide education programs is, how do you help these people? How do you help them to find the resources? How do you help them through a very challenging place in their life to make their life a little bit better? How can we extend them staying in their home environment? How can we help their quality of life?
If somebody listening to our podcast today, or even maybe this has run across their mind in the past and through a conversation or something with a friend, if somebody has a heart for, somebody has a passion for wanting to help veterans, they already have an agency, a home care agency, how do they go about becoming a provider for veterans?
Actually become enrolled in the VA's health network. And so we have two pieces to that. There's the western half of the United States is through TriWest, and then the eastern half of the United States is through Optum. So they would literally go on to the va.gov's website, look up Community Care Network, click on wanting to be a provider within the Community Care Network, and run through the enrollment process with that. Obviously, I would do a pitch to Paradigm. We actually assist with and help people to understand and how to do that enrollment, so they can reach directly out to Paradigm, to myself or to one of our team, and we can walk them through and assist them and actually help them with the credentialing process to get enrolled in network. But either way, either directly going through one of those options through the community care network or working with the Paradigm, either way will allow them to be pointed in the right direction to get enrolled.
Greg, and I understand that you can't really nail this down completely, but just on average, how long does it take someone, let's say they've already gone through the enrollment process with the VA, they've gone through va.gov and they've done all of the work that they need to do to satisfy the Veterans Administration, but they've now turned to you because even though, like you said, you can do a lot of this for yourself, that's one of the reasons why, for example, 21st Century Healthcare Consultants exist, is because the credentialing process, the licensing process, the business side of all of this it's a big tangle for people to have to try to undo if they're not familiar with this part of the industry.
Marketplaces and pieces and parts of these credentialing markets or opportunities across the country where you have a VA regional medical center, like you might have, and I don't want to call anybody out, but you might have Atlanta or you might have Orlando or you might have this big VA hospital that's telling their network, we have enough providers, we don't want anymore. So then they consider that a saturated market. So then they don't let you enroll so then they deny you or you get declined. And so then there's this whole challenge associated with that. So we help people to understand the navigation of that. Are you in a saturated market? Are you not in a saturated market? Are you in a place where, you're going to be, 6 months a year to get enrolled? Are you never going to get enrolled? Here are some opportunities for you to advocate for yourself to get enrolled. We can actually help people to navigate that process. And of course, because we're a billing company and we work off of the billing side of that, we don't charge people for enrollment advice, so on and so forth. The way we get paid is actually getting you into network and then helping you provide care to veterans. And then on the billing side, we get paid on the back end. So from a Paradigm standpoint, we genuinely are working through all these processes to help agencies, to help veterans to get more care. And we're genuinely getting reimbursed on the back end after the service is being provided. So we're a great resource from that standpoint.
And I don't think it's possible to overstate what you just said. You are a great resource for people who are interested in doing this type of work. It is something that will save them not only time and money, but it takes a lot of follow through to get involved with the government and deal with some of these larger departments and agencies. It's easy to get discouraged, I would imagine, and kind of lose sight of the end game if all you do is feel like you just sit on hold or you get the runaround or you're getting conflicting information from two different people. So having someone such as Paradigm to be able to stand there in the gap, so to speak, for folks who are out in the field wanting to be able to increase their services to veterans, and you all are able to come in with your experience, your resources, your connections, and so on and so forth, and help them get through that process, hopefully, in a little bit in a quicker way, but also in a way that doesn't deplete people of their energy and their commitment to the mission, so to speak, of whatever it is that they're wanting to do for veterans. In the last couple of minutes that we've got, Greg, I was wondering if you might share with us a time when you personally were involved with having someone who contacted you through Paradigm and you walked them through the process of becoming qualified to be able to help veterans through their agency, and until the time that they were actually out there doing that. Is it any story that sticks out in your mind in particular?
Provider that started services with us, I would say a year ago, September, in Illinois. And he wanted to become a provider to the VA. It was a passion to provide care to the VA, and assisted him through the enrollment process. Well, the first thing he did, he was actually a provider of personal care on the private duty side. The first thing he did was he went out and interviewed all of his families and had his staff interview all the families, the people that were paying privately for care and getting services and care back through his agency. 14 of his families were able to get enrolled, get started, provide services that they were then having their services and care paid to him by the VA for families that were having to come out of pocket for that same level of care out of his client base. Over the next year, through community outreach, reaching community centers, VFWs, American Legions, Elks Lodges, Moose Lodges, independent livings, case managers in hospitals, out talking about how to help veterans enroll in programs, how to grow his business, so on and so forth. I know that when we looked at him because I used him not too long ago as a resource to talk about success, he's at 63 veterans that his home care is providing care for on a full-time basis. So, and in just over a year and a half, he went from opening the doors of his
Wow.
business to having about 75% of his entire client base being veterans that are receiving care and services. So to me, that's about as big of a success story, both back to veterans in a not
That's
too
great.
great of a community, um, and so taking it from opening my doors or changing a new business plan to create care to veterans up to being incredibly successful.
That's great. I mean, I actually got shivers listening to that story. I wish we had more time, Greg. There's so many other questions I'd love to ask you. I hope that we can get you to come back again sometime soon. But for all the information that you have shared with us, thank you so much. Thank you for the work that you're doing with Paradigm. Thank you for the way that you're impacting the world with a passion that's obviously one of yours personally. And again, thank you so much for your and your family's service. It's been a wonderful podcast. Thank you for joining me. I want to thank my audience for sticking with us and getting through this. We've had a great time here with Greg Bean, Vice President of Business Development for Paradigm, and we look forward to having him back again. More information, please check out our website, and we will post the phone numbers and websites for you to be able to get in touch. I'm Kate Rose. Thanks again for joining us, and we look forward to seeing you next time on Home Care Today.